everyone. I am Gayatri. I am a nursing lecturer in SNS College of Nursing. Today we will see about the stroke. What do you mean by stroke? Stroke it is a sudden interruptions of blood supply to the brain. It is also otherwise called as cerebrovascular accident. It leads to the brain cell death and also the disabilities. The epidemiology of stroke is major cause of death worldwide. The common in elderly population and also the increasing the incidence due to the lifestyle changes. The types of stroke can be divided in three. First one is ischemic. It can be 85% of cases can be affected blockages of blood vessels. Second stage is hemorrhagic ruptures of bleeding. Third one is transient ischemic attack. It can be otherwise called as temporary warning signs. The risk factors of stroke is non-modifiable: age, gender, and heredity. The second one is modifiable. It can be hypertension, diabetes, obesity, smoking, alcohol, and also the high cholesterol. These are the pathophysiology of stroke. The due to the etiological causes can be leads to the blockages of rupture of cerebral artery, can be leads to the reduced oxygen supply, can lead to the brain tissues to ischemic cell death within the minute. The hemolysis can be leads to the free hemoglobin release free home. It leads to the free radical endothelial damage, can be leads to the vasoconstrictions, can be leads to the vaso accumulations, can be leads to the cerebral ischemia. It can be leads to stroke. These are all the clinical manifestations. Simply, we have to remember B first. B means balance, A means eyes, the F means facial dropping, the patients having the facial dropping, the arm weakness, the speech difficulties, and also the time get help to the assess. The diagnostic evaluation. First one is history collection. Second one is physical examination. Third one is neurological examinations, and also the under the neurological examination we have to assess the sensory motor sensation and also the 12 cranial nerves we have to assess. Third one is blood test, and then computerized tomography, CT scan we have to compulsory if needed we have to take, and then MRI if needed we have to take, then carotid ultrasound, then ECG we have to taken to for the diagnostic purpose. Then management of stroke. The management of stroke is the management is goal of management is restore the cerebral blood flow and also the prevent the complication and also maintain the vital function. First one is emergency management. Under the emergency management, immediate treatments to important during the acute stage. Assess the airway, breathing, and circulation. Monitor the vital signs. Assess the level of consciousness and also the neurological assessment. Check the blood level. The supportive care we have to provide the maintain the oxygenation, establish the IV access, maintain the fluid and electrolyte balance, and position patient properly, prevent the aspiration. The ischemic stroke management is the blockages of blood vessels, thrombolytic therapies we have to provide, and antiplateletic drugs like aspirin and Colibrod gel and anticoagulant drugs we have to provided to the patient. Hemorrhagic stroke management if measures control the blood pressure, reduce the intracranial pressure, surgical evacuations of hematoma if needed. Then surgical management if needed, surgical procedures we have to then the procedures like carotid endarterectomy and craniotomy and aneurysm clipping and ventricular damage. Next, move on to the nursing management, airway and breathing, maintain the pattern airway, providing the oxygen therapy, suction secretions if needed. Then concentrate about the nutrition, the swallowing, assess the swallowing reflex and provide the soft tube feeding if needed. Prevent the aspirations, then mobility and skin can changes position every 2 hours. Perform the passive and active exercises. Prevent the pressure ulcers. Communication support. Use simple language. Encourage the communications aids. Then elimination care, psychological support, rehabilitation cares also we have to provide under the rehabilitation, physiotherapy, occupational therapy, speech therapy, psychological counseling, preventions of the stroke is regular exercise, healthy diet, controlling of blood pressures and diabetes, stop smoking in the prevention method. Then complications of the paralysis is the paralysis, asphyxia, depression, bed sores, aspirations of pneumonia. Conclusion: strokes are a preventable condition. Early detection and lifestyle changes are one of the key. Community health nurses play a vital role. Thank you.